Hi everyone. Today we are going to discuss about amoebic dysentery. This is me, Mrs. Chancy, tutor working at Triple M College of Nursing. Objectives. At the end of the lecture, the listener will be able to define amoebiasis, enumerate the causes, its clinical features, enlist the mode of transmission and incubation period, mention the stages, risk factors and diagnosis of amoebic dysentery, and also provide the health education on its prevention. Introduction. So invasive intestinal infection with amoeba of the genus Entamoeba histolytica. So 50 million people are affected worldwide annually. What is amoebiasis? Amoebiasis or amoebic dysentery is a gastrointestinal illness that develops when an organism called parasite enters your intestine. So amoebic dysentery is the causes. It includes a protozoan parasite that is called an Entamoeba histolytica and 3 other species, that is Entamoeba dispar, Entamoeba moshkowski and Entamoeba bangladeshi. The clinical features include infection by Entamoeba histolytica are mostly asymptomatic. Dysentery that includes body pain, bloody diarrhea and colitis, abscess in the liver, hepatomegaly, weight loss, fever, hematological spread includes T cell destruction, and other sites include brain and lungs. So these are the clinical features. Mode of transmission. Transmission of amoebic dysentery occurs mainly through the fecal-oral route, contaminated water or food, and cysts that can survive in the environment for weeks and months. So mode of transmission is mainly through the fecal-oral route or contaminated water or food. Stages. Stages include the cyst which is ingested, passes through the stomach, transforms to a trophocyte in a small intestine, and then invades into the large intestine, causing damage to the tissue, increased secretions, and eventually bloody diarrhea. These are the stages how the infection is taking place. So what are the risk factors? The amoebic dysentery is more common in developing countries and tropical areas with poor sanitary conditions. People who live in institutions, the travelers or immigrants from developing countries with poor sanitary condition, and men who have sex with men are higher at risk for getting this disease. Incubation period. The incubation period is usually 2 to 4 weeks, but it can range from several days to months or years. Diagnosis includes serology, stool sampling, colonoscopy, and ultrasound. Diagnosis includes serology, stool sampling, colonoscopy, and ultrasound. How can we manage? Symptomatic amoebiasis can be treated with administration of metronidazole, idoquinol, or paromycin. Complications. The complications include anemia, liver abscess, lung amoebiasis, and peritonitis. Complications include anemia, liver abscess, lung amoebiasis, and peritonitis. Prevention. How could we prevent it? Avoid eating raw fruits and vegetables. So wash it properly, cook, and then to consume. Avoid drinks with ice cubes. Drink only sealed bottled water. Wash your hands frequently with soap and water after using the restroom or changing a baby's diaper. Use condoms and safe sex practices to reduce your exposure to feces during the sexual activity. Hope you understood the topic, its causes, the incubation period, and how to prevent it. Here are some of the references. Thank you.